Despite the new death toll in the epicenter of this pandemic, a glimmer of hope.
There's no doubt that we are now bending the curve. The bad news isn't just bad. The bad news is actually terrible.
New York setting another one-day death toll record, 779 people. And the governor saying that number will rise as more patients struggling in the hospital lose their fight.
The longer you are on a ventilator, the less likely you will come off the ventilator.
But this morning, the infection rate appears to be slowing in New York. Some hospitals now releasing more patients than they're admitting. An encouraging sign for the physically and emotionally exhausted healthcare workers. My Maimonides Hospital in Brooklyn bringing ABC News into a makeshift ICU. Dr. Daniel Nicola was seen ripping off his mask and walking away from our cameras after calling a patient's family to update them on their loved one's condition.
I mean, one of the parts of our job is delivering bad news to patients. Honestly, it's one of the more psychologically exhausting parts of the job. So telling someone that their family member may not make it, it really does, it takes a lot.
As New York shows signs of flattening the curve, other potential hotspots are being closely watched, including the Washington, D.C. metro area, Baltimore, and Philadelphia.
And we're triangulating testing data with the attack rates, with the hospitalization, with the number of cases, and really creating a mosaic of who needs what when to ensure that every American is served well.
A leading model now predicts 60,000 Americans will die in the pandemic by August. That's down significantly from the 100 to 240,000 it predicted just weeks ago. Doctors credit social distancing and saying we can't let up.
What you do with data will always outstrip a model. You redo your models depending upon your data. And our data is telling us that mitigation is working. So again, as Dr. Berg said, keep your foot on the accelerator because that's what's going to get us through this.
But as Americans wonder when life will get back to normal, a sobering message from one expert.
We're not going to get back to normal, the sort of before COVID, the BC kind of normal, where we go traveling, we go to restaurants, we go to concerts, we go to religious services, we go on cruises, until we have a vaccine that protects everyone. That's 18 months. It's not going to be sooner.
In the meantime, there's new hope for a potential coronavirus treatment now in the works.
It's a pill that blocks the coronavirus from attaching to lung cells in test tubes. It could be used to both treat and prevent COVID-19, and it is set to start clinical trials in humans this spring.
And according to the New York Times, new studies show most cases of the virus here in New York can be traced to people who traveled from Europe in February before the travel ban.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.